Now let's move into the how-tos. In this section of the video, we'll show you how to test your blood glucose levels and how to store and administer your insulin. But first, an important caveat. Always consult with your healthcare provider to learn what's best for you in terms of when and how to test and when and how to administer your insulin. Now, testing and blood glucose management. When you're taking insulin, you must monitor your blood sugar levels. You want to know that the insulin you're taking is working, and you also want to avoid the very serious side effects that can come with sugar levels that are either too high or too low. Regular testing, and by regular I mean several times a day, is the only way to keep your blood sugar levels balanced over time.
To test your blood glucose, it's really an easy operation. First, you would use an alcohol swab to wipe any bacteria or dirt. Pick up the lancet, which is a device which has a little needle in it that you can't see, and it has a spring mechanism on it. I just push the lancet. A drop of blood will come up on the end of my finger, and I just take that drop of blood, and I get a readout in 5 seconds.
How do you monitor your blood sugar? With this. This is a glucose meter. There are several different models available, but they all work the same way. You should choose the glucose meter with which you are most comfortable. Along with your glucose meter, you'll also need an alcohol swab, test strips that are matched to your glucose meter, a lancing device, and a lancet which is used to puncture the skin.
Take the alcohol swab and then take it, cock your lancet. I puncture my finger. Didn't hurt at all. There it is. And then you get your drop of blood. You take the blood, put the strip up to it to get 1 drop in. My sugar's kind of high. It's 235.
The process is simple.
Okay.
After you test, it's important that you document your glucose level. You want to be able to identify trends and patterns over time so that you don't react too rashly to any one reading. Writing down each reading will help you stay in control.
It takes a lot less time than you think and a lot less blood than you think too. It doesn't take very long at all. And it doesn't really hurt. Just poke your finger there, draw a little bit of blood, and then just wait. And the cool thing is you only have to wait 5 seconds. And that was it. And it's good. It's 111. Yay!
Overall, you'll want to keep your blood glucose at the recommended levels, which are between 90 and 130 milligrams per deciliter before meals and under 180 milligrams per deciliter during the day. Of course, your specific blood glucose levels may vary, and you need to discuss target levels with your healthcare providers.